Hello, everyone. Morning. Welcome back.
Good morning.
Good morning. We have Alexandra Redmann, Dr. Alexandra Redmann, on board here.
Thank you. Yes, good morning, everyone. Thank you for joining. Maybe a few words about myself before I start. My name is Alexandra. My background is in linguistics, actually. So I got my PhD doing research on the human brain and how language is processed in the brain while we speak. So I worked a couple of years in research, and since then I am working in a consulting company called Y Digital that is concerned with conversational AI, among other things. So it's specialized in artificial intelligence and in building solutions and bringing solutions to production that help people communicating with machines. And today we're going to look at the opportunities of the use of these technologies in the healthcare sector. So we're going to take a sort of round trip, first defining a bit what conversational AI means and what we define it as. We're going to look at some use cases, also from our own customer experience, and also some experiences from customers and learnings that we got from these past projects. So what is conversational AI and what do we mean by it? In general, you could call it, the set of technologies very broadly behind applications that enable people, clients, patients, users to naturally interact with machines. So the emphasis here is also on naturally, so being able to speak it or type or write in a way that you would also do naturally with another human being. And the AI part of it, conversational AI, artificial intelligence, can enclose all kinds of different technologies, from machine learning technologies to the use of knowledge graphs and graph technology. So there are lots of opportunities to build solutions such as, for instance, voice assistants, chatbots, applications that help you scan for information in large sets of documents. All these kinds of the collection of these kinds of technologies, that is what we call conversational AI. And to start out with, I'm going to show you a video of a use case that was a project that was done in the UK in 2019 concerning the use of AI for patients with Alzheimer's disease and how it can be used at home for them to make their lives a little bit easier. So I'm going to play that video, and I hope everyone can hear the sound all right.
Yes, in the autumn, we went to the local hospital in Southampton and met the neurologist, and he told us with a very sad voice that I did have dementia. I've children, one in New Zealand, one who lives in Ukraine. I still try and live independently as much as possible. Yes, taking my medication is a great problem. I've all kinds of systems set up in the past with alarms and reminders.
The My Carer skill can be programmed by a carer or person living with early stages dementia, and through the app a person can customise a whole routine with instructions step by step. At the time scheduled, Alexa sends a voice reminder and the interactive guidance starts.
Hi Jennifer, it's time for your medication. To start, say Alexa, open My Carer.
Alexa, open My Carer.
Do you know where to find your medication?
No.
Your medication is on the dining room table.
And if a task is incomplete for more than 30 minutes, then the carer will receive a notification on their mobile to let them know to go back and to do that task.
Did you take your medication?
Yes.
Well done.
Cooking is very difficult for me, so one needs to be reminded to turn off things as well as to turn on things.
Did you turn off the oven?
Yes.
Remembering names can be difficult. Doesn't mean to say we don't love the people.
Jennifer, today is Claire's birthday.
Who's that?
Claire is your sister-in-law. Shall I set up a call with her?
For Alzheimer's Society, it can really help us understand the person's routine and patterns of behaviour throughout the day and understand that disease progression.
We live as well with it as possible, and I believe we can with dementia. And that's why I'm so grateful for all these wonderful apps that help us do that.
Yes. So indeed, we could see that this is a tool. I think it was a use case that was explored. I'm not sure if the project is really was really realized to full extent, or if it's still in use. But that's just as an illustration of what could be possible to help people at home. There's, if you look at the Netherlands, so these data that I'm going to present are always from the Netherlands, but because our company is a Dutch company. Also in the Netherlands, Alzheimer's is becoming more and more relevant, also because the population is aging, and the healthcare costs connected to that go up. So it's a relevant problem. It's generalizable to other countries as well. And we see that in healthcare, not only do we see rising costs, but we also see other issues that increase the pressure, like shortages of staff that you all know, these kinds of issues. So, for instance, this is some research collected, a survey collected among healthcare professionals, also asking them how they experience the situation within healthcare, and they also report that the shortage of staff, affects their daily lives and their well-being as well. So the hypothesis is now conversational AI can help improve the lives of clients and healthcare professionals. And I hope that with the use cases that I'm going to show you now, you can get an impression of the opportunities that are possible in this area. So starting out with 3 use cases that I'm going to present to you. The first one is called the Kletsbot, again, a Dutch project. And it is aimed at exploring how we can help people who feel lonely. So this is not meant in a clinical way. So it's not connected to a diagnosis. It's just the general feeling of loneliness. And there was a survey among Dutch people which showed that actually a large percentage of Dutch adult people report that they feel lonely sometimes, and 1.2 million people report that they feel very lonely sometimes, which can also incur extra healthcare costs. So the question was, if loneliness is such a growing issue, what can we do with technology to support people to help them feel less lonely? And the Kletsbot is a project that was done together with the university in Nijmegen and also the University of Applied Sciences. And the idea behind the Kletsbot was to build a voice assistant that enables, chit-chat, small talk, that enables a person who feels lonely at home to just have somebody to talk to. And in that case, it would be the voice assistant. So the question was, the project looked at it first from a use case or from a user experience kind of perspective. So is this something that people would appreciate? So they also had a part of the project consisted of students of a voice assistant that was brought to some users' homes, and at the other end of the voice assistant there wasn't actually a voice assistant that was implemented yet, but it was actually a student on the phone saying the things that voice assistants would say theoretically. So just to say what people think of such an interaction. And that was also really interesting, the results of that research showing that people do appreciate this kind of technology. And the idea behind this project was that such a voice assistant could have 2 big features. One feature would be indeed to be able to talk with it about anything that you would like. So from chatbots, we often know closed domains. So chatbots typically work best if you talk to them about a certain topic. So they are designed to help you with your insurance, or they are designed to help you set up an account on a website, or track the status of your order in a web shop. But the idea here was to have an open domain voice assistant that you could talk about anything that you would like. And for that, we used the idea was to use GPT-3, so a technology that allows you to statistically, based on statistics, generate likely continuations of a text that you give the machine. So in this case, you could give it a sentence that the user says to the voice assistant, and then it would generate an answer that is empathetic, that fits the conversation, but it's not as closed domain as many chatbots are. And this could sound something like this. Here's the how the first prototype of this would sound like.
Hey, Kletsbot. Start conversation.
Hello, how are you feeling today?
I'm alright, just a little bit stressed.
Hey there, I'm sorry to hear that you're feeling stressed. Can I help you with anything?
Do you have any tips for how to deal with it?
There are a lot of different ways to deal with stress, but some popular methods include deep breathing, relaxation techniques, and exercise. Sometimes it can also help to talk to someone about what's causing you stress.
Exercise sounds nice. Do you think that will help?
Yes, exercise is a great way to relieve stress. It can help to improve your mood and increase your energy levels.
That sounds nice. What exercise do you suggest?
There are a lot of different exercises you can do to relieve stress, but some of my personal favorites include yoga, walking, and running.
Walking sounds nice. There's a nice park just next to where I live.
That sounds great. Walking is a great way to relieve stress, and it's also a great way to get some fresh air and enjoy nature.
Yeah, I love nature.
There's something special about nature that just makes you feel good, isn't there?
That is true. Alright, I think I will go for now.
Okay, sounds good. I'll be here if you need me.
Goodbye.
Bye-bye.
Yeah, so with this one, I think you could clearly hear that it was a very open domain conversation. Another feature that would be desired for such an assistant, which would also be to put the lonely person or the person who experiences loneliness in that situation in contact with maybe friends, family, his or her own social network. So that is also something, a connection to other systems would also be a desired option here. And what people reported now after experiencing this kind of technology in the test with the students that I talked about is that indeed they really enjoyed having such a technology. So that doesn't mean that, of course, it would be ideal to be able to talk to a human being, but maybe if that is not available, so if there's if for some reason there is no one to talk to, then maybe talking to such a voice assistant could be the next best thing, better than not talking to anyone. And maybe also, some people really reported, I would miss this technology. Now that I've experienced it, I would miss it if it wasn't here. So this is, I think, a good indicator for, that people really appreciate this kind of interaction, even though it is not human. Looking at the second use case, it's for Vlans, and Vlans is a national organization in the Netherlands that provides knowledge about care and support, so in the healthcare sector. So they would like to make knowledge accessible. They, for instance, offer medical protocols that explain how to do certain procedures, the requirements, the required steps, risks involved in procedures. So they have a database with these protocols. And what they wanted to do is make them more accessible by using speech and voice technology. So let them be spoken by an AI. And they didn't want to rewrite everything manually because they have many, many protocols, and it would take a lot of time to look at all of those protocols and rewrite them. So why is rewriting necessary? Well, these protocols often look like this. So they are lists of things, lists of materials, and or lists of steps that are necessary. And if you want to, for instance, in a voice assistant or in any other kind of application, if you want to make this accessible to a healthcare professional, then these should, it would be much more accessible if these were formulated in sentences and in as full sentences in a flowing text that is not just bullet points. And here we can also hear an example of how it would sound like if we use natural language processing and AI to transform these texts that would take a lot of time to manually put into sentences. But we can use AI, natural language processing, to transform them into into a text that flows like it was a natural conversation. So let's hear an example.
You will need the following materials for this protocol: a needle cup as drain for the stitch cutter, a gauze to put the knot or sutures on, 2 pairs of gloves, and a waste bin. You will need these sterile materials: a cutter or scissors with a sharp point, and tweezers. Grab the following materials if you need them: suture strips, a sterile dressing, alcohol 70% with gauzes for disinfection of non-sterile materials.
So we can see that some, for instance, lists can be put into a bigger context, into sentences, to make it sound more natural. This one. Connected to this is the third use case for Zorgbalans, which is a care provider. So they provide intramural and extramural care, and they are on the receiving end of these medical protocols. So the healthcare professionals that work for Zorgbalans, they actually have to administer those procedures, and Zorgbalans wanted to help their employees by making these protocols and this information about how to do a certain procedure more accessible and easily searchable. So maybe, your task is to remove stitches, but you don't know how to do it. Maybe you don't know it for a specific patient. You don't know if there are any risks that you need to take into account. So we made this database of protocols searchable and built a personal assistant around it, so that healthcare professionals can interact with it and interactively easily search for these kinds of protocols. And this is also something that can be further developed. For instance, it can be connected to other systems to allow for integration of planning, of schedules. So getting in the daily work of these healthcare professionals, it might help them to be more efficient by getting information on schedules or on the current status of a patient. And this is also something that users of this app reported. They feel like it's time saving. It's a bit like chatting with a colleague who's always patient and friendly. And they also reported that it's fun to use. So there does seem to be quite a lot of potential, also not only from patients, but in the healthcare sector, also within the group of healthcare professionals. There seems to be a lot of appreciation or a lot of interest in these kinds of technologies. So what are some of the takeaways from these projects that we have done so far, and also how do users themselves experience the interaction with these tools? So we've seen, I think, a couple of good examples for the ways in which conversational AI can help improve quality of life of patients, but also reduce the workload within the healthcare sector itself, or help reduce costs. What we can also see, and this is data from the National Voice Monitor, which is research that has been done or is been done every year in the Netherlands to find out how people are using voice assistants, how they experience the usage of voice assistant, and what they search for, what they like to talk about. So one thing that we've seen is that a growing percentage of elderly people also use conversational assistants, and that is also, of course, relevant for the healthcare sector. And regarding the question, is this a technology that would make sense for the people that are important for certain patient groups, for instance? What we also see is that this is a different research, not from the Netherlands but from the US. What are currently the most asked questions to these kinds of assistants within the healthcare sector? And a lot of, depending on the kind of application, a lot of questions are of course, about illnesses or symptoms of illnesses, about how to take medication, or more details about medication, finding other information, other pieces of information like that. But a trend that we see, and that is also something that I believe will become even more relevant, is going from purely asking for information to transactions. And by transactions, I mean, for instance, booking appointments, or actively finding the nearest hospital close to you, and things that are that are connected to other systems and result in an action that makes just makes interaction easier. What we also see in these kinds of projects, and basically everything that has to do with natural language processing and artificial intelligence, that of course it's not always that easy, and the technologies are always changing, and we still face challenges that we have to keep in mind, that are also important to take into account when developing these kinds of solutions. So, for instance, in your solution might want to take into account different languages, dialects, accents that people speak. You oftentimes, with voice assistant, you have little control or no control over the setting where people listen to or speak to your application. So it might be very noisy, it might be outdoors. As always with human-machine interaction, users might not react in a way that you expect. So you have to design your solution in a way that really allows flexible conversations that still feel natural. And there are some things that people are really good at detecting, but it's a bit more difficult to train machines to be good at detecting them. For instance, the tone of voice, or if someone speaks in a sarcastic way, so detecting emotions, that all of these things are possible, but still, it's still difficult, and things that we need to take into account. Also, of course, just different wordings, taking into account that some people might use slang or jargon that the designers of the solution didn't expect that would be that you would have to recognize these kinds of words. What we also see is that from the National Voice Monitor research, what we see is that a lot of people have used voice assistants and technology like chatbots before, but also a lot of them are still maybe a bit skeptical, and they also say, I would use it more. I would use it more often if I felt that my questions, if I asked them just naturally, that my questions are understood correctly, and I don't have to repeat myself a lot. I don't get the frustrating, I didn't understand you, could you please repeat your question all the time? So this is really something, getting the technology really up to a level that makes people feel natural in the conversation is a really important task. Yeah, so coming back to our initial hypothesis, conversational AI can help improve the lives of clients and healthcare professionals. I hope that with the few use cases that you've seen so far, you got an impression of the opportunities that exist. And of course, there are more opportunities in other technologies that can be leveraged. And if you have any questions about these projects or other kinds of technologies, I'm very happy to answer those. And with that, I would like to thank you very much for your interest in this, as I find, fascinating topic. And I'm happy to answer your questions now. So I will stop sharing and go back to the conversation.
Thank you so much, Alexandra. I really appreciate that. So yeah, we've just a couple of mentions here in the chat group. I particularly have a problem, and I think Dr. Heinz also has a problem with Siri, purely just because she's from Jamaica, I'm from Africa, and the dialect is a bit of a problem when it comes to conversational AI. At what point do you think that will sort of be a level playing field?
Yeah, absolutely. That is a really relevant problem. I think it's become more and more clear that is something that needs to be addressed in the past years. So if you like, in the maybe 10 years ago, when these technologies were really more at a starting stage of their development, it was even worse, and it has become a bit better. And I hope that was also your experience. But it's always the question of you have to train these models on the right kind of data, and that is something that companies have to invest in. So, well, it will take some time, I think, until that is a level playing field, but I hope that it will be, so the technology is there to make it a level playing field. So my hope would be that it doesn't take too long until that's the case also. I mean, that is what we want. We want to make it accessible to everyone. So, yeah, so that would be my hope.
Absolutely. Good answer. I see there's a question that just popped in. I see one of our attendees, Yusra, just made a comment. This will be life-changing for some elderly when it works perfectly. So I can see that happening.
Yeah, so one of the things, I agree. So if these kinds of solutions, if they work perfectly, they can have such a big impact. I think some of the solutions can also have an impact already when they have to work, but when they have a very small scope. For instance, I could imagine this like a technology that helps you at home only with one thing, but it does it really well. That could already be an improvement. But indeed, so if these solutions, as I said, they have to be trained, they have to be configured in a way that they really understand what you're saying, because also, for instance, a voice assistant that is at the home of a patient, you really want to make sure that they don't get into that situation that is a bit frustrating, that they don't get understood, and then they have to repeat themselves and they get confused maybe. So that's really something to test really, really well, and to make sure that it works well before actually start regularly using it. But I think the technology is there, and it has a huge potential of indeed helping people when sometimes other options are not available.
Absolutely. Okay. We have a question that just popped up here from Ekaterina. Don't you think it can be a huge risk with AI in medical area? If, for instance, we're going to use it while assessing the patient's health state, do you know some new technology or someone who's working in this direction?
Sorry, can I see the question as well in
the... so you can just click on it.
Chat. Oh, yeah. Thank you. Yeah. Oh, no, that's a different question. Now I see a different question. Sorry, could you repeat the question? I was with...
If you scroll down, there's two questions there.
Oh, yeah, I see that this will be life-changing, and I see the one from Dr. Hilary Hines about the 90-year-old grandma.
Okay.
Yeah.
Sorry, so I'm probably the only one who can see the questions here.
Oh, yeah.
So the question is, don't you think that it could be
I see it now. I see it now. Great. Okay. Yes. Yes, I do. I agree. Risk in the sense with the use of technology and the use of AI. I think in specifically AI, because it's based on statistics and based on training data, you have to make sure that you have your regulations in place, and that in the end, for making decisions, you're really clear about whether this is a decision that was helped or supported by technology, but it is a decision that maybe a human being must make in the end, or should make in the end. So these are also ethical concerns that you always have to take into account, and also in all of the projects that we do, of course, ethical considerations always play a role. And I agree, especially in the medical profession, of course, there is not much room for error. You cannot put technology into place that is subpar and will cause more harm than help. So it's really, I think there is a risk in the sense that solutions could help, but they would have to be tested really well to make sure that it's working correctly. I personally do not know specifically about the patient health state. I personally do not know about anyone who's working on that, but I know that there is technology to assist at least with that. I mean, in the healthcare profession, you already work with machines that can be connected, and then information can be combined and can be learned from that. So that's definitely technically possible. But I personally do not, I couldn't name something for you. Yeah, and then there's the story about the 90-year-old grandma who can't walk so well, and where it helped to teach her to use Google Nest to turn off her lights. And I mean, so this, you say it is 80% successful, and that is also something, of course, for a very simple command like turning off the lights, that should be more than 80%. So that is indeed once again the issue of we need language models that take into account more variation in language, because that's just I think that is an error that has been made in the past very often, to cater language to just one group, cater technology to one group, and that is not an error that should be made here. So I agree. So I think 80% is you would hope that it's more than that. It's already good, and of course, if that can prevent accidents, it's already a great achievement, I think. But it's yeah, it would be nice if it was more than that.
Okay, so here's another question from Fabrizio. Fabrizio is from Italy. How do you make these technologies compliant in a sector like healthcare that is so regulated? Audits require a whole series of documentation, including technical issue lists, to be able to put a product on the market. Yeah. With AI tech, it seems difficult to determine any problems beforehand, or does it?
Yeah. So that is part of every project, whether it's within healthcare or outside, or the medical sector. But I agree, in the medical sector that is so heavily regulated, that is particularly important. And I think it is regulated, for instance, on a national level, but you also have regulations that pertain only to a specific clinic, for instance. Also, the way of working, that is something that always requires a lot of research in the beginning of these projects, and then a lot of research into and connection with the stakeholders and with people at the organization who really work with these regulations and have a deep insight into how they are applied, so that you can make sure in the beginning what we build will be able to be compliant. And if necessary, it might be able to not implement, it might be necessary to hold back on a functionality or not implement something if you cannot follow regulations, of course. So that is something, indeed, that is always a very important part of any of these kinds of projects. And I think also relating maybe a bit to the question about the risk of assessing a patient's health, for instance, with these kinds of technologies, my personal opinion would then be, if you cannot build something that one follows all of the regulations, even if that is complicated to assess, but you really have to make sure that you have the right metrics that you can measure, you have the right documents to show that you follow everything. So that is one basic requirement, but also the ethical requirements. So and those can be also formal regulations, but also discussed on a project level. But if you cannot follow these, then maybe it might not be a good idea to implement it at all. So that is indeed something that I think, especially for the medical sectors, I agree, it's really, really important, and will be part of any application of these technologies. And I hope it is already part of any technology that gets applied in the medical sector.
Okay, great stuff. Just the last one though. Are there sort of any guidelines, or is it depending on jurisdiction? So for example, in Europe or EU, they'll probably have different guidelines to what they do in the West. Does it sort of change in that aspect, or is there sort of a universal guidelines? And if so, is there sort of a reference you can perhaps point everyone to go and read up? Or
you mean guidelines in the use of AI?
Yeah.
Or yes, indeed. So on European level, for instance, that's the one that I now personally know. There has been some changes in legislation as well very recently. So indeed, there are now, and I can also share a link to that. So there's indeed there is indeed regulation. Is also because this is something where politics and regulations are kind of, they have to deal with the new technology that comes in, and the technology sector is really fast, really dynamic and fast changing. So these kinds of regulations also always have to keep up and will keep changing. So that's also always something to keep in mind, that when you design a solution today, in a few years it might not be compliant anymore. So that's really something that you have to keep in mind. But indeed, so on European level, there are also European-wide agreements on the use of AI.
Perfect. Okay, thank you so much. I enjoyed the interaction. Fantastic questions from everyone. Thank you so much for everybody. Our next talk will start in a few minutes. We're just going to set up the back end. But can we have a huge round of applause in our chat group there from everyone. Thank you so much, Alexandra. Appreciate your time and effort.
Thank you. You're welcome. It was really a joy to speak. And also thank you to everyone for the questions. And as I said, so if you have any further questions after the session, my email is included in the slides, and I guess there's always a way to find contact.
Could you share your slides with us? Because we're going to have a portal where everybody can sort of grab them.
Absolutely.
So they can just email you, or could they just contact you on LinkedIn?
Both is fine. I don't have a preference.
Fantastic. Thank you so much. Have a lovely day, okay?
You too. Bye-bye.